In discussing reproductive physiology, we're going to compare and contrast the male and female reproductive systems. Now, each of them has a reproductive organ or gonad, and these gonads produce gametes, and they also each will have a reproductive tract, and these reproductive tracts are specialized to house and transport the gametes after they are produced. So let's first look at the male reproductive system. In the male, the gonad is the testes. Now, if we looked into the testes, what we'd find is that it is a tightly compacted, coiled structure, which consists of something called a seminiferous tubule. And the seminiferous tubules are the actual site of sperm production. Now, if we take a closer look at this, what we'll see is that the lining of the seminiferous tubule is lined by these cells depicted, and these are referred to as Sertoli cells. Also within the testes are these blue cells, shown here in this diagram, and these cells are referred to as Leydig cells. So here's another artist's rendition of the Sertoli cells. In this picture, it would be the pink. This is the sperm developing, so this is the process of spermatogenesis that occurs within the seminiferous tubules. The function of the Sertoli cells is that they provide a proper environment for spermatogenesis to occur. They secrete various substances which will help promote spermatogenesis, and one of these things is that they secrete a fluid which helps move the developed sperm through these tubules. Also within this fluid will be nutrients to sustain the sperm. These Sertoli cells are going to respond to a hormone that's secreted from the anterior pituitary, and this hormone is called follicle stimulating hormone, or FSH. So here again we have our seminiferous tubule. These purple cells on the outside represent the Leydig cells, so here we show a more zoomed in view. And the Leydig cells are the site of production of testosterone in the male. These Leydig cells respond to another hormone from the anterior pituitary called luteinizing hormone, or LH. So testosterone obviously is very important in the male, and it has effects that vary both before birth and after birth. So before birth, testosterone is important in that it results in masculinization of the reproductive system. It also promotes the descent of the testes from the abdominal cavity into the scrotum. And this is important because the scrotum provides a temperature which is slightly cooler than what would be inside the abdominal cavity. And this slight change in temperature is important for proper spermatogenesis to occur. Now, from birth until puberty, the testes and the Leydig cells do not secrete any significant amount of testosterone. But once puberty is reached, this is when the Leydig cells are going to begin producing testosterone. The testosterone at this point causes growth and maturation of the reproductive system, meaning that it causes the testes, the penis, and the scrotum to all enlarge. It's at this time that men begin to produce sperm. Testosterone governs the sex drive, or libido. There are also many non-reproductive actions of testosterone. Many of these we refer to as secondary sexual characteristics. So these are external characteristics that distinguish male from female, and they're not directly involved with reproduction. One of these things is what we call male pattern hair growth. So testosterone causes hair to grow, which is much thicker and longer in areas such as the face, the chest, the back, and the abdomen. Typically, men also have a deeper voice than females. Now, obviously, these are all very general statements, but for the most part, men's voices are different than females because of the effects of testosterone on the voice box. Testosterone causes skin changes that we see in men. This often results in rougher, thicker skin. And also what we call the classic male body shape. So men tend to have increased muscle mass. There's also a different distribution of fat. For men, their fat are typically distributed around their abdomen, and their women tend to have fat that's more distributed around their buttocks or their thighs. Men tend to have broader shoulders and narrower hips. And this is a diagram which once again just demonstrates the various parts of the male reproductive tract. So we have the testes, we have the seminiferous tubules are all going to eventually end up in draining into the epididymis. And from the epididymis, we have a structure called the vas deferens. So the sperm will be traveling up the vas deferens. They then will travel through tubes that will pass through the prostate gland and then out through the penis through the urethra. We also show the bladder here just for perspective, and these are going to be the ureters here draining into the bladder. So a very common method of sterilization for the men, or birth control, would be what's called a vasectomy. And with a vasectomy, what's done is a 2-centimeter section of the vas deferens is cut out. The ends are then tied, and that then will prevent sperm from being able to be ejaculated. Sperm are still produced, but they produce and then they eventually die and are resorbed. So a very common practice of birth control with men. Now this is something that can be reversed with microsurgical techniques. So years ago, these were very common signs seen all around when microsurgical techniques were first introduced as a way to reverse this vasectomy. The prostate gland is associated with the reproductive tract in men, and this is a very important organ in that it can create some fairly significant complications. This is a picture of the bladder. This is the urethra leaving the bladder and then entering into the penile shaft. Right outside the bladder is the prostate gland. Now this is a picture which shows a very common problem that occurs with men. Once they get above the age of 40 to 45, the prostate gland can begin to enlarge. And this is called benign prostatic hypertrophy, or BPH. And you'll notice that while the prostate enlarges, it narrows the diameter of the urethra, and that can lead to problems with emptying of the bladder. Here's a more simple depiction of the bladder with the prostate surrounding the urethra. And this is indicating something called prostatitis, which is an infection or inflammation within the prostate gland. And that can also cause narrowing of the urethra and therefore difficulty with emptying the bladder. Now there's a specific protein which is secreted by the prostate. It's called prostate-specific antigen, or PSA. This is a protease that's produced by the prostate, and it functions to liquefy the semen, thereby allowing sperm to travel easily through the fluid which carries the sperm. PSA is something that many of you have probably heard of. It's an important biomarker that can be tested for prostate disease. So a PSA level can be indicative of problems with the prostate. Most concerning would be the possibility of an elevated PSA being associated with prostate cancer, but it can also be elevated for other conditions as well. With the rise of the use of PSA, many men have opted to have the blood test done rather than having an exam of their prostate to monitor for prostate cancer. This is still something that, although the urologists will use the PSA, they still feel it's very important to have the prostate manually examined to check for cancer. And that is done with what's called the rectal exam, or digital rectal exam. So this demonstrates the location of the prostate gland to the rectum, and this shows how a digital exam can actually feel that posterior portion of the prostate, and this is where many of the cancers are going to occur. So the urologists are typically going to recommend both a digital rectal exam as well as a PSA test be performed for the routine surveillance for prostate cancer. Here we have a picture which shows a cross-section through the penile shaft. And what we see is that the penile shaft consists of lots of vascular type tissue, and this is tissue that can easily become engorged or filled with blood. Now, when we previously have talked about innervation of systemic vasculature, we highlighted the fact that sympathetic innervation is the predominant portion of the autonomic nervous system that innervates arterioles. This, however, is an exception. Parasympathetic innervations innervate the penile arterioles, and here they use a special chemical messenger called nitric oxide. The effects of nitric oxide is to bind to receptors on the penile arterioles, resulting in dilation and thereby increasing blood flow. This increase in blood flow engorges this vascular tissue, and as it engorges it, it will then occlude the venous outflow, and so the combination of those two results in stiffening of the penile shaft or an erection. Now, the mechanism by which nitric oxide works is by increasing the second messenger, cyclic GMP. Cyclic GMP causes a smooth muscle relaxation. To get rid of cyclic GMP, there's an enzyme called phosphodiesterase. Phosphodiesterase, or PDE5. So when it is used, PDE5 will break down cyclic GMP and cause the penile arteriole to return to its normal size, thereby ending erection. Well, very common medications that are used these days are for erectile dysfunction, which is problems with this vascular inflow of blood. So common erectile medication inhibit this PDE5 enzyme. So by inhibiting this enzyme, it allows the levels of cyclic GMP to remain elevated and thereby enhances erection. Now, a final thing here with the male reproductive system is to understand that the testicle initially originates in the abdominal cavity, and then it must travel out and go down into the scrotum. So the pathway which it traverses here is called the inguinal canal. So this is a picture which kind of gives an idea of the inguinal canal. So it's through here that the testes is going to descend until it reaches its final place here in the scrotum. The problem with this is this creates a potential area of weakness. And this is where we then will test for inguinal hernias. So the way this is performed is to take a finger, stick it into the scrotum, and then reach up and put your finger right around where the inguinal canal opening is here in the abdominal wall. We'll then have the patient cough, and by coughing they're increasing their intra-abdominal pressure, and that would cause anything that might tend to want to push down through here to be felt by the finger. This is an example of a hernia, again a weakness in a muscular wall which allows contents to pass through where it normally shouldn't, and so here if a finger was placed through and this small intestine was being able to push through, it could be felt by the examining finger. Here's a picture of a young boy with a fairly sizable inguinal hernia. And the problem with this is that occasionally, fortunately it's not real common, but this is why we tend to get these things fixed, is that the contents within this hernia sac can get twisted. And if it does, it can occlude the blood supply to the portion of the bowel that's passing through this hernia. And here we see a picture of small bowel, and we can see that this is clearly necrotic or dead small bowel as a result of this being twisted within the hernia sac.